Greetings and welcome back to our platform. This is the platform that brings you the latest health information. It is called Your Health Matters a Lot. Last week we discussed a very beautiful topic. It is called Peptic Ulcer, but due to time is always fighting us on this platform. We actually could not go in depth, so we decided to bring it back this week as also part 2, Peptic Ulcer. But before then, I think you are seeing a very handsome guy today on this platform. I'd like to give him a chance to tell you who he is, his name, and then we continue. Thank you, sir. You are welcome.
Thank you so much, Pole, for having me here. And my name is Arjun. I'm from India.
Thank you very much. So we have a very Indian nationality today on this platform. It's a beautiful thing to have a foreign national. Like I said, we will keep bringing guest upon guest. All you need to do, like, share, follow, comment, and give yourself to this platform, then you will get the latest news. So the question actually this week we should discuss here is that last week we presented on ulcer and we focused a little bit on hunger. We asked the follower to try to maintain and eat something. And someone asked me, Doc, is it possible that I keep eating and still I get ulcer? So what they're actually trying to say, whether outside of hunger, is there any other causative agent of ulcer? So I would like for you to please help us to explain this to our followers today, sir. It's my pleasure to really have you today. Thank you.
Yeah. So when we are hungry, so in that case, when we are having ulcer, it is because of acid. So when we are eating, so the acid is not that much in our stomach. So as the follower is asking why we are getting ulcer. So we have other agents also which cause ulcer. Like one, we have bacteria, H. pylori bacteria.
What is called H. pylori bacteria? Because people like to know more about this bacteria.
Yeah, I'll explain.
Okay.
So H. pylori is a bacteria which is commonly found in contaminated places. Like if a person is having H. pylori in his body, so it can transmit through kissing or any touching contaminated surfaces, like eating contaminated food also.
So basically, we as the doctor is saying we should try to keep ourselves healthy. H. pylori gets into the stomach by what? Poor hygiene. Please, he said kissing, we don't want to focus on that for now, but please, you know what to do. So is there any other factors do people get, any other causative agent we get ulcer?
Yeah.
Apart from H. pylori?
Yeah, we have other other causative agents also.
Okay.
Like we have NSAIDs.
What are NSAID? This is, someone will be watching and they will ask, what are NSAID? Can you please tell us what are NSAID?
Yeah, I will tell. So the medical professional guy, people who are watching, they will know what are NSAIDs. But
Okay.
I will explain to like other people.
Yeah, because me, I'm not medical, so you should be able to explain
I
that
can
to
see,
me.
I can
Okay,
see.
yes, no problem. Yes.
So NSAIDs are non-steroidal anti-inflammatory drugs,
Mm.
which is commonly used for inflammation.
Inflammation. What is inflammation? I want you to be a little bit simple with me.
The inflammation is like when any infection got into our body,
Okay.
it produces heat to kill the bacteria.
Okay.
So that is called
That is basically inflammation. So
Yeah.
how does it connect next now with peptic ulcer?
So
How does it call a peptic ulcer?
okay, so NSAIDs have a mechanism of action of COX inhibitors. So COX are the agents which increase heat in our body. So what NSAIDs do? It decreases COX and which decrease heat ultimately. But there is a side effect of COX. It also decrease molecule in our body which reduces HCl production. So what NSAIDs have done? NSAIDs have reduced COX, which is reducing temperature.
Okay.
Good. But later, what it is doing? NSAIDs are uh, NSAIDs are inhibiting a molecule which is decreasing HCl.
The HCl production.
Yeah. So
Okay.
what happened ultimately? HCl will not decrease; it will get increased.
Wow.
Yeah.
Wow. So basically, sir, can you give me one or two drugs that fall in the class of NSAID? At least so someone else can know to actually know this one is NSAID.
People don't know NSAID, but I will tell you one drug name. Everybody will know that.
Okay, just tell me, let's see.
Paracetamol.
Paracetamol.
Yeah.
So, in our simple contents, you are saying we should stop taking paracetamol without doctor prescription. So, if I take paracetamol recklessly, let me put it that way, like I'm just taking without doctor prescription, I just go out and take it. If I take it for a long time, it is possible to get peptic ulcer?
Not necessarily. That if you are taking paracetamol for
Yes.
a long time, it is not harmful. But if it is very long time, it can cause liver damage.
So basically, very long time for paracetamol cause liver damage.
Liver damage.
But you said paracetamol is an acid, and
Yeah.
an acid called peptic also.
Yeah.
So if I take paracetamol for a long time, does it also contribute towards my peptic also?
Yeah, maybe it can if you are having the paracetamol without food, like
Paracetamol without food.
yeah.
Now I love that phrase, paracetamol without food.
Mm.
So basically, and we have an acid. He said paracetamol. That is true. And do you have any other acid that people know very common around?
Ibuprofen.
Ibuprofen. Wow.
Yeah.
That is-
Diclofenac.
Diclofenac. You see,
Yeah.
these are drugs we normally take around. So
Yeah.
you are trying to say taking this medication without doctor prescription, one, it is wrong, and we should be able to take it with food. Wow, okay. So followers, you already know, like, share, comment, and give your input. You should be able to take your NSAID and any other medication with food, as doctor said. But then let's get back to someone discuss about this treatment of ulcer. I know basically we don't give treatment on a platform because it is not good. So
Yeah.
we normally ask the people to go to their doctor.
Yeah.
But I want you to tell us the class of drugs, how to treat this ulcer thing. How we should go about doing it? Which are class of drugs? Which medication they are important?
So in ulcer we have so many class of drugs. One is PPI, which is proton pump inhibitor, and another one is H2 antagonist,
H2
and we have
antagonist.
other drugs also like prostaglandin inhibitors.
So in also, so I just want you to name some few drugs that you have in H2 antagonist
Yeah.
and you have on a PPI.
So under PPI we have, or maybe some of the viewers know already, it is pantoprazole, rabeprazole, omeprazole, all these drugs.
I think the most common one in that class is called omeprazole. Most people know these drugs.
Yeah.
And I think this is the most drugs people normally use around the world,
Mm.
omeprazole, because the mechanism is very fine. That is why the doctor will ask you to take it on empty stomach. It actually inhibits the production of the HCl. But let's leave that for now. So
Yeah.
basically, these are the drugs. But then the H2 antagonist, which is we have one drug. Can you name any one drug in that class?
H2 antagonist.
Yes.
We have cimetidine and ranitidine.
Cimetidine. So you see, cimetidine was drugs people used to use back then.
Yeah.
But due to some investigation, they are saying it causes impotency in man. So
Yes.
study has actually canceled this cimetidine. And ranitidine, they say it has some basically carcinogenic effect. That means it may cause cancer if you take it for a very long period.
Yes.
Okay, no problem, follower. I think you are actually moving with the group. So what would be your conclusion message to everyone that is watching us today?
So I will say, take your food properly, and before taking any medicine, just consult your doctor that whether you have to take it before food or after food. Like with paracetamol, if you take it before food, it will very good. But if you are taking empty stomach, your stomach will burn because it will increase acid production, which will ultimately cause peptic ulcer in long term usage, not for one time.
Thank you very much, sir. I think today it is well explained. So, take your paracetamol with food. Don't take it without food.
Yeah.
Thank you for watching us. Like you already know, your health matters a lot. Please like, share, and comment. See you next week. Bye bye.